Hello, welcome to another episode of Arthritis at Home. I'm Kelly Lendvoy, VP of Communications at ACE, and I'm speaking to Cheryl Koehn, ACE's president and founder today. And we're going to talk to you about a national survey that ACE is conducting across Canada, and it's part of a national series of surveys that ACE is undertaking to find out what people with arthritis in Canada are thinking about some of the key issues of today. Welcome, Cheryl.
Thank you, Kelly. Super exciting to be here to talk about these surveys. They're so important to what ACE does.
Before we dive into the survey that ACE has just sent out into the field and open to the public this week, maybe, Cheryl, you want to just talk a little bit about the first survey that was conducted, and those findings are going to be published in April around virtual care.
Yeah, so that's exciting. Obviously, that most recent survey is now in the field on reimbursement access to medications. As you know, Kelly, of a series of being fielded in 2021 to inform our work was on virtual care, and that was conducted February and March, and we are just fine-tuning the last of the graphic design of both the Joint Health Insight and the infographic that will accompany the publication of the findings on our virtual care survey. And I think all of our members, all of our subscribers, everyone that tunes into our programming, I think is going to be really excited to read some of the findings. I don't want to steal the foundations, but I think something that really maybe didn't surprise me, but I was really happy to see was the design for continued virtual care services post are talking together today, still very much in the midst of a pandemic. But we have some clues in the arthritis community here in Canada, as well as in some other countries where we had respondents, what people like me who live with arthritis every day are looking for. So very excited about that. And as you know, it's going to be published in the next couple of days. But today we have fielded the reimbursement access to meds survey, and we're really talking to each other today to let, of course, our membership know about that, and also give them the, why, where, when, what, how behind that particular survey or this particular survey.
So most Canadians have access to reimbursement coverage for their medications, in this case for arthritis medications, through a patchwork of public and or private drug plans or insurance plans. And when it comes to public, it could be federal, provincial, or territorial governments who offer varying levels of coverage and decide who's covered, what the patient and the plan pays. And those public drug plans generally provide coverage for the most in need, depending on or based on age, income, and the disease condition. But also many Canadians and their family members have drug coverage through their employer, through a private drug plan. And finally, some Canadians, and we're going to be interested in finding out in this survey, have no effective drug coverage and pay the full cost of their medications out of pocket. With that sort of context, what is ACE aim or objective with this survey, Cheryl?
Well, Kelly, that the country, people in our country and our government at the federal level is now formally initiating conversations around national pharmacare. And while we're not asking questions specific to what people might want out of national pharmacare, what they're experiencing currently in the reimbursement process, we think will be very important to that bigger discussion, because bigger discussion is intended to solve the problems that exist, obviously, today when Canadians go about getting their prescriptions filled. So overall, we're trying to get a sense of not necessarily what meds are covered specifically, but rather what experience is like in getting either private or public reimbursement for their arthritis. And we're talking about advanced arthritis medication, so not necessarily non-steroidal anti-inflammatories or prednisone or methotrexate, things like that, but certainly the more expensive medicines that would fall under that advanced therapy umbrella. So it's really to get a flavor, Kelly, of what are people like me experiencing in their journey of getting reimbursement access for their medicines. They're very much needed medicines written by script by their rheumatologist.
What sort of barriers do you think are going to be uncovered in the survey?
Yeah, that's a great question. We're asking a variety of questions. By the way, the survey is fully anonymous. The data will be pooled and analyzed in aggregate. Just be assured that, you know, we're not looking you up and finding out your specific answer and trying to find out who you are. We're not able to do that, as the survey is taken anonymously to protect people's privacy. I think, Kelly, what we're going to find, obviously, whenever you field a survey, the people that are fielding it have some ideas about what they might discover. As a person living with rheumatoid arthritis myself and on these advanced therapies, where you do have to undergo quite a convoluted, in some cases, application process, for lack of a better word, I think we're going to find that people are confused by it. They don't know who to ask questions of. If they ask those questions, they may not be getting timely enough answers. An advanced therapy, whether it's a biologic or a targeted small molecule, is a big deal. It's a big decision. And sometimes you don't want anything to slow it down once you've made it. You know, you're anxious to start, you're anxious to see if it will do for you what you hope, you and your physician hopes it will do for you, and returning you back to a more normal quality of life. So I think we're going to see some delays in terms of time it takes, in terms of how the process is to go through. The reimbursement process, whether it's public or private, can involve a lot of form filling out. So we're interested to see that, because we think we can bring to the table some good ideas about how to make it more efficient, not just from the patient perspective, but from the payer perspective as well. So those are just a few guesses on my part as to what we'll find. I also think we'll find out, you know that working towards equity in the healthcare system for people with arthritis who are not white, non-white, so Indigenous peoples, other people of color, older people, like we're looking to try to see how their answers differ from answers of people who are not from those communities, so that we can show specificity when we're talking about these challenges.
So you mentioned the payers. What is ACE going to be able to do with these findings?
So, sometimes when you ask questions, you don't like the answers that you get. And at ACE, we're brave enough to take that on, I think. And we're also brave enough to turn those answers around and show them to people who are charged actually with doing things in the way of reimbursement policy development and implementation. They're charged with meet our needs, not charged with doing things that don't meet our needs. So unless they hear what our needs are, they're not going to get it right. That would be my hypothesis. And I think likely it would be their hypothesis as well. So really what we want to be is a positive force, discussion around what needs are, but also be able to sort of plant directional signs in the ground for them as they move their refinement of policy forward, or if they're building new policy. That if everybody says, oh, it's easy, we understand it, well, then that's a good news story. It gives us a way to then go and turn around to payers, public and private. Guess what? You're doing a really good job. Here's what these were based on the response we get. Obviously, unless we get every person with arthritis responding with our survey, which would be nice. All we can do is speak on behalf of those and the numbers that are shown in our survey. But that's really the benefit of not just working with our community, but working in community. And when I say in community, I mean payers, government, patients, organizations like ours who work hard to represent them, the whole arthritis community getting in on the conversation. And I think our survey results will be conversation starters and directional signals.
To just underline that, that's why it's so important that we can hear from patients across Canada. And
Yeah.
in many ways, and so we really, really encourage people to take this survey, to share this survey with other people who you think it applies to, because it is giving the patient voice when ACE is doing its advocacy. And in many ways, this is a wonderful complement, a way to bring to life one of our most powerful advocacy tools, and that is our report card. Many people are aware that we developed a report card in our early days as an organization, and it's something we've become known for. And that's an evaluation of public drug plans across Canada. It's updated on a monthly basis. It's available online for anybody to look at to see how their provinces rank or rate next to other ones. And it's a numbers kind of interpretation, but it doesn't have that direct patient perspective that we're being able to gain through this survey.
Yeah.
So it's almost like it's almost like a 1-2 punch, that when we are going in to see policymakers.
It doesn't talk. The report card static shot of the reimbursement program, but it doesn't talk about the experience of actually getting it. Right. So what people are going to find at the end of this video is a slide that gives them to the link, Kelly. It is hosted on our Survey Monkey platform. Again, it's anonymous. We are the only ones that see the data, and when we see it in aggregate. And we encourage everyone who comes across the survey to share it with their friends who are interested in taking it. It's available in Canada only because the reimbursement situation is very unique, but we encourage everyone to go and please take it. It is open, by the way, until April 30th, but don't wait to take it today. It's that we get as many responses as possible, that the data, the number that respond can be analyzed in a way that will make the results statistically significant. So we need a big N is what they call it. So we're looking for.
Are there some questions there where people can offer their own opinions or observations as well?
Yeah, we do have a few questions that have additional fields in them. I always find, Kelly, when we look at our data, the numbers are great. Looking at a pie chart or looking at a graph is great. You get a good, pretty decent indication on what people are thinking or experiencing. Boy, it's that qualitative data that we pick up in those open boxes is always super helpful and super interesting. And when I, as a fellow person with arthritis, read them, I go, hey, that's just like me. Or, oh, wow, I didn't know about that. That's really horrible. Like, we better do something about it. It's a way of finding new ideas as well in terms of ways to help our members. So yeah, take the survey, everyone.
We're going to provide some links at the end of this episode so people can simply click and immediately get to our website and get to the survey. So yeah, once again, we really hope that you can, I think it's only about 10 minutes or less than 10 minutes it's going to take people.
It's 10 minutes. I think there's a few questions. If you answer one way, you skip a few questions. But roughly it takes about 10 minutes. There's about 23 to 28 or 29 questions. It's painless. Yeah, we'd love it if you could participate.
Great. All right. Well, thank you, Cheryl, for spending some
Thank
time
you.
with us today to talk about our survey. Look out for the links at the end, and we look forward to seeing the results and sharing them with Canadians from coast to coast and policymakers when that time comes. So thanks for joining us today on
Yeah,
another
so
episode of Arthritis at Home. And Cheryl, you have some final words?
no, I just wanted to say, so as you just said, they'll be published in our summer edition of Joint Health Insight, as well as with an accompanying infographic.
Thanks a lot, Cheryl.